Dear Grandpa, now that you are gone and the days have passed, I reflect on the goodness of your life, but also the faults within our healthcare system, which caused you and your family such difficulties in your final days. The day you fell in the shower at home was the day I realized you were in need of help. I am so thankful I was there for you that day, but I realize now that you were in such need of rescue weeks before. You see, our modern healthcare systems address the needs at hand, which for you was your pneumonia. Your frequent hospitalizations for pneumonia in your last months were treated and yet recurred. No one seemed to see the bigger picture, gastric cancer. They all knew of the diagnosis, yet seemed to ignore the increased weakness, diminished appetite, severe weight loss. You were even told the cancer had stabilized and was no longer growing. You believed your doctor would tell you when the end was near. You thought the hospital staff would tell you if you shouldn't go back home. And you believed you would be told if a cure was not in your future. You trusted. The kind, humble man you are, did what you were told and waited to get better. You went home after each discharge, attempting to live life as you wanted, the only way you knew. Independent is what you had been for your full 86 years. You knew of no other way. You were not told the end is near. You were not given options. Your wife was not told you were getting too weak for her to care for. You believed this was temporary and you just wanted rest. Grandpa, I watched your days begin to be consumed by sleep. When awake, your wife and family pushed you to eat, but eating more than a few bites made you sick. Yet you pressed on, thinking you still must fight. No one told you any different. The day you fell is a day I will never forget. Realizing the fluid in your lungs and your extreme weakness, I was glad to be there for your last ride to the hospital. After the swallow study showed you were aspirating each bite, I knew the future was bleak. And after learning the feeding tube was no longer an option due to the location of your gastric tumor, I did know the end was near. Yet where were the people who should tell you this, the people you trusted? Where were the end-of-life discussions? Where was the advanced care planning, the planning needed for your final days? Medical professionals continued to fight the pneumonia with antibiotics, and physical therapists were sent to your room. I watched food trays continue to be delivered when it was acknowledged you were continuing to aspirate. Where was the truth in this? Why did your family continue to visit each day, believing you were just tired and needing to gain strength? Reflecting now on your final days, Grandpa, I am so sorry for our methods of modern healthcare. Studies have shown that 61 to 91% of older individuals want to discuss end-of-life care. These elderly patients see this as providing assurance that their wishes will be respected and as an opportunity to share their wishes before they are no longer well enough to do so. They also see this as a way to assist their family with crucial decision-making. Majorities of elders see the responsibility of end-of-life discussions to lie with their doctors, who they expect to speak with honesty and straightforwardness. Recent and past research has identified numerous barriers to facilitating end-of-life discussions. The most frequent barrier was families. It has been realized that families are often unwilling to accept their relative is at the end of their life or wish to protect their elder from upsetting conversation. Another barrier is professional limitations. Some doctors are uncomfortable with the paradox of promoting health yet having to discuss its complete failure. Yet many physicians have simply not received the training in interpersonal communication necessary to carry out these personal conversations. Another barrier is the time limitations carried by medical professionals. They simply do not have the time to carry out these lengthy discussions. The final barrier is patient reluctance to discuss. There is a generalized feeling by many vulnerable elders that, quote-unquote, others will decide. Some feel their families will decide, others believe in leaving matters in God's hands. While many have such trust and confidence that they believe their doctors will decide for them. The truth of the matter is, few elderly ever have end-of-life care discussions with a health care professional. As advanced practice nurses, we must recognize the failure of our current systems in promoting a good death for those we care for. We must recognize our responsibilities and understand if we don't tell our patients and families that the end is near, it is very likely no one will. Advanced care planning involves assessment of living situations, symptom management and enhancement of quality of life, and patient and family counseling with continuity, communication, and coordination of care. Grandpa's needs were not addressed during his decline and approach to death. As his advocate, I put a stop to meal trays, antibiotics, physical therapy, and further cardiac consultations. I requested social services to speak with the family about hospice. Once hospice was implemented, it was only then that I felt relief that he was receiving the care he needed. It was then that he could receive all of the comfort measures he needed with his family by his side. As nurse practitioners, we will be caring for elders with advanced chronic illnesses that will lead to death. These patients require ongoing professional and personal care services. We must recognize when life-sustaining treatments must end and the comfort measures to ensure a good death must begin. Though we are the guardians of life and health, we are also advocates for and protectors of the dying. Do not dismiss the weight of this responsibility.